Okay.
Hi, my name is Dominique from Well Medical Arts, and we wanted to demonstrate an example of a liquid facelift today. We are going to be putting filler in the upper face to lift the lower face. So we have already gone in and done some temples. We're going to go in today and do some cheeks, some sideburn area, and some lower face. And the idea is to put the filler up and back so that we are lifting the nasolabial folds and the marionettes by lifting everything up and back.
So the things I'm concerned about are I'm losing volume in my face just as a function of being 44, but I don't like how heavy I feel down here. I see a lot of sort of sagging down in here in the muzzle, I guess. And so I'm wondering how we can lift that up or fill that in somehow.
Okay, we have a great solve for that. What we're going to be doing is putting filler in your temples, a syringe here and a syringe here to anchor up this way. And then I'm going to be going and doing your cheeks. You have a little bit of a break right here. It's as we lose estrogen and collagen, the superficial layer thins, and then you can see the underlying structures below. So we can see this fat pad right here and this fat pad right here. So I'm going to be putting a half a syringe fanned into the point of your cheek right here, and then I'm going to be coming down from your brows and then fanning a half a syringe this way inwards towards your lateral cheek, and then a half a syringe out towards the hairline. This is going to be just a little bit of filler all through the cheek, which is going to lift the lower face up. Then we're going to go in and do just a little bit of filler at the marionette to get the corners of the mouth to turn up a bit. Great. So I'm going to draw on you, gently turn towards me and look at my nose. I'm going to be marking right underneath your pupil. And then straight down from your brow and right across from your nair. This one a little bit like that. And then for the temple, here, and here. Great. So we are going to do Bellafill for the liquid facelift because Bellafill is the 5-year filler. It's the only filler where I can progressively enhance someone to full correction. Most women have a lot of areas where they need volume replacement, where they have volume loss. For example, temples, tear trough, cheeks, nasolabials, marionettes, preauricular. So with all of these areas, if I used a biodegradable filler, the first area would be gone before I got to the second or the third area. With the Bellafill, what I'll do is I'll map someone's face and determine exactly how much they need where, and then we start checking it off. We've already actually gone in and done her temples and her tear trough. We need a little bit more. So what I'm going to do now is go in and lidocaine the areas that I'm going to be doing so that it's comfortable for her. I try to strike a happy balance of only using a little bit of lidocaine so there's not too much swelling. So a little 1, 2, boop, tiny poke, and you're feeling just a little bit of pressure. I like to buffer the lidocaine with sodium bicarb so it doesn't sting. Great, good job. And then how was that, okay?
Oh yeah.
And then we rub it down just a little bit so it soaks in and does its job and starts snumming up. Exhale, boop, tiny poke. I also inject slowly so that it causes less tissue trauma. So we've gone in and done injectable lidocaine at all of the insertion points. And then I put a little topical BLT at the marionettes. I don't like to use injectable lidocaine here. It will cause a little too much swelling. So now I'm going to be using a MicroCannula. The cannula is just like a needle but has a dull tip, so it's able to wiggle around blood vessels. It doesn't cut and lice through them. It causes less bruising, tissue trauma, less swelling. It's just a more elegant way to work. So, okay, go ahead. You ready?
I'm gonna close my eyes.
All right, go ahead and turn to your left. And I'm going to come on in and just make a small 1, 2, boop, tiny poke where I go in with the cannula. 2, boop, tiny poke that way. And so I'm going half a syringe this way. Look at that, she's not even bleeding, so nice. And a tiny poke this way, boom. All from this. It's amazing, we can get a whole syringe of filler in all from the same hole. There's our teeny tiny hole, not even bleeding. There we go, sometimes you can hear it. How you feeling?
Oh, it's fine.
Good. Looks very nice, there we go. Building up a little bit of lateral cheekbone, isn't that pretty? And then I'm going to turn around and go the other direction. There it is. And this is where I'm looking to get that malar break of yours. Kaylee, can you see the break from your angle over there? So this is the third pass. I went one above, one in the middle, one below.
Mm-hmm.
There we go. There. There. Yep. Got it? Yep. One more right below.
Mm-hmm.
There we go. And let me feel.
Now we do one more up.
One more up.
Yep.
There.
Beautiful.
Awesome. Thank you. And then I go in and rub, 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 rub. It's beautiful, Kimberly. Just beautiful. There we go. Fantastic. There we go. Perfect.
I feel your hand on my cheekbone, but I don't feel the cannula or the filler at all.
Isn't that wonderful?
Mm-hmm.
We like that. So look at it go under the blood vessels. Could you see it just go under those blood vessels? That is so amazing. Just so amazing. Over this way. Wonderful. Look at that. Wonderful. Fill those hollows.
Looks great.
Wonderful. Almost there. A little bit more right there. Beautiful. Beautiful. We've got it. Thank you. And then we rub, rub, rub. Rub, rub, rub. And then like to put a little topical arnica to heal it right away. So we have just finished the temples, the lateral cheek, the medial point of cheek, and you can tell this medial cheek on the right side has had a chance to swell. You can tell this is swelling by pressing on it and seeing a little bit of fluid under. That's fluctuance. That will go down. I like to use a warm compress at the end to help the swelling go down. Next, we're going to, so we can really see how much it really has lifted her lower face. She has very little of this marionette left. So next we're going to go in and finish off by just putting a little bit at the marionette. And everywhere that I put the filler, the body's going to be stimulating collagen production. So notice how sometimes I was laying it a little deeper and then going and putting it a little more superficial. Everywhere we put it, it's going to do collagen stimulation. And we usually see that at about 3 months. People come back from their next Botox and the face just looks kind of dewy and healthy, just like a little collagen blossom. All right, and gently turn towards me. There we go. A little tiny 1, 2. Exhale, hang in there. Good job. Good job. You're doing great, babe. Okay. There we go. Very nice.
Kaylee?
Alrighty, here we go. So I like to pull the skin taut, bevel up, and the tip goes right past the canthus of the mouth. And 1, 2, exhale. Whoop. There we go. There we go. Okay, I think that's great. I'm gonna go in and I'm gonna smooth it and feel. Gently open. Thank you. There's just a little bit left. Like I was saying, you only want a little bit right here. And let's take a look at them. I like to use a warm compress to take down the swelling. The heat vasodilates, it opens everything up and lets all of the swelling fluids come out and down. So if you feel like you wake up in the morning and you're a little swollen, you can run a washcloth under the hot water or put it in the microwave for like 35 seconds. And then keep it on there. You can actually feel the swelling kind of come down. And then what we want to do is we want to get all of these fluids. Your body just said, she poked me, and sent down all the fluids. And we want to get all of these excess fluids. You've got a little bit right up here, over here towards your lymph nodes. So we do a technique called lymphatic drainage. I like to use my middle finger, put it at the bridge of the nose, and then put about medium pressure and just gently massage over towards the lymph nodes, towards the temple, and then down, because your lymph nodes are all through here. Let me get the other side. There we go. Good amount of pressure. So you can really feel it just about move the fluids over and down. Yay!